Today, we would like to talk about one of the topics which is very close to my heart, melasma. Melasma, brown color pigments surface on the skin. This type of conditions we will need to explore and then try to find out the root cause. And why is melasma so difficult to treat? This is the challenge. What exactly the cause of melasma? The commonest cause of melasma that what we know is, for example, over sun exposure, when the skin not really healed as what it's supposed to be. Second possible cause is due to genetic inherited. Commonly, our patients will share with us that their mother, their grandmothers, they will have exactly the same pigmentations on their face as well. And hormonal changes. Ladies during menopause, they might notice that they have sudden surge of pigmentations. Not only that, ladies who are going through pregnancy, that will also lead to melasma or abnormal pigment surface on the skin as well. The other commonest cause are, for example, overutilizations of skincare on the surface of the skin. It will make the skin become very sensitive and different area of the skin heal at different stage, which eventually leading to pigmentations. Is melasma the only pigments that will surface on our face? Definitely the answer is not. There are many different types of pigments on the face. We commonly call the pigmentations on the face as a dark spots. However, when we seriously look into the pathophysiology and the nature of the pigment, different type of pigment will require different mode of treatment. To get the right diagnosis is extremely important. For example, the pigment which can be easily treated like freckles. So freckles is a type of pigmentation which is small, tiny, and usually it distributes around the cheek area. So freckles usually is genetically inherited. For this type of pigment, we can easily solve with 1 to 2 sessions of laser treatment. This will be a simple pigment which can be eliminated easily. So the other pigmentations are, for example, like over sun exposure. It might lead to sunspot. When we are talking about over sun exposure pigmentations like sunspot, the eliminations of pigment, it will not be as simple as freckle. To identify the sunspot is pretty easy. Sunspot surface is well demarcated. The pigment, it might range from mild to dark brown color spots. So when we are talking about the sunspot eliminations, we can use the laser to eliminate it. However, how many sessions do we require for the sunspots to be eliminated? Compared to freckles, sunspots we might need more than 2 or 3 sessions. The reason why is sunspot is due to some inflammations which happen on the surface of skin where the skin is unable to heal properly. So when we perform the laser on the sunspot, the risk of getting post-inflammations, hyperpigmentations will be slightly higher, but the pigment can be easily eliminated as well. Now we come to melasma. This is the challenge. Melasma is a type of pigment that recur despite with treatment. How do you identify that the pigment is melasma? When we are looking at the face, the distributions of the pigment, usually melasma is a brown color patch which distribute around the forehead area, around the cheek area, at the nose bridge, on top of the upper lips, and this is a common distribution. Besides the brown color pigmentations, when we are assessing the patients, we do notice that many times these brown color pigmentations come together with like pink color or red rashes on the surface of the skin. So most of the time, the pigment and the redness two comes together. And then when these two comes together, this increase the challenge of getting the pigments off. Melasma is a type of pigment which commonly happen nowadays and create a lot of emotional distress for our patients. 15 to 50% of prevalence among pregnant women, and it can also affect up to like 1.3 to 33% of the populations. Among the populations of people that having melasma, about 10% are male and 90% of those people are female. The reason why for this happening is because melasma happen in women with a lot of hormonal change. So women tend to have menses every month. The hormone fluctuates throughout the month. Not only that, during pregnancy year, there is significant hormonal surge, increase in the estrogen and progesterone. During the menopausal age, there is significant hormone decline because of reductions of estrogen and progesterone and the imbalance of estrogen and progesterone, which leading to the melasma to become more prevalent. What are the root cause of melasma? And why is melasma so difficult to treat? Number one, not only the production of melanin is increased, and there is injury at the basement membrane area, which causes the disruptions of the skin conditions and the chronic inflammations. If you are not able to eliminate the inflammations in the body just by utilizing the treatment options that we have, eventually melasma, it will recur again when the root cause surface up again. The root cause of melasma may vary from patients to patients. A detailed history before proceed for treatment is extremely important. So to heal the basement membrane disruptions and to eliminate the chronic inflammation is one of the extremely important steps for us to eliminate melasma.